We've seen some pretty strong advocacy from doctors and business leaders in the last few days about the need to reopen the international border in particular. Virgin CEO Jane Herdlicker, the latest to do that overnight. She's got herself in a bit of hot water, though, you'd have to say, making the case that the borders should be open. Obviously, Virgin wants that for their international travel business, but she says it needs to happen even if some Australians would die as a result. These comments have caused a lot of criticism and pushback, the Prime Minister himself calling them insensitive.
During the course of this pandemic, Australia have avoided 30,000 lives lost when you compare it to the average fatality rate of like countries in the OECD. 30,000 lives could have otherwise have been lost had we not had the success we've had as a country working together. And so I think that has to be understood. And I regret that those comments were somewhat insensitive. And I would encourage people. 910 Australians have lost their lives. Every single one of those lives was a terrible tragedy.
Now, Virgin's PR machine in full flight this morning, a tweet on the Virgin account saying, quote, "The safety of our guests has always been our #1 priority. Nothing will change that." So a bit of quick clean-up act there, Tom, from the Virgin PR team.
I'm all for open, honest conversations. Anyway, I might be in the minority. Meanwhile, Trudy, the Prime Minister conceding the government needs to step up the pace of the vaccine rollout for disability care. Those people in disability care, shockingly low at the moment.
Tom, it was pretty damning what we heard yesterday at the Disability Royal Commission, where these figures were laid out that fewer than 1,000 people who are in disability residential care in Australia have actually received their jab. That is only around 4% of the total population in there. This is shocking because these are people in phase 1A of the rollout. This was meant to be the top priority for Australia's rollout. It's the responsibility of the Commonwealth. They're doing aged care and disability care, but this pace has been moving at a glacial speed so far. Plenty of criticism today about why more hasn't been done more quickly to vaccinate the vulnerable. Here was the pushback coming from Labor and the New South Wales Premier, and Scott Morrison's promise that he's going to step up.
People with disabilities were supposed to be at the front of the queue. And what's clear is that they're not getting the support that they need.
New South Wales is keen to do our part, but the federal government has that responsibility, and we urge them to intervene in any which way they can to expedite the process.
We've got to step up the performance there. There's no doubt about that, and I'm working with our health officials to achieve that.
So a commitment from the Prime Minister to step up the vaccine rollout for disability care, but it's worth just looking at the numbers for just yesterday. We got this official update from the government about how the vaccine rollout's tracking in aged care and disability care in the last 24 hours. The update is 0 jabs, Tom.
Yeah, there you go. Trudy, thank you.